Good morning. Welcome everybody to Sunrise Hospital and Medical Center. My name is Todd Sklamberg. I'm CEO here at Sunrise Hospital and Medical Center. And on behalf of our entire staff, as well as the United States Department of Health and Human Services Office of the Assistant Secretary for Preparedness and Response, or ASPR, the Federal Emergency Management Agency, the state of Nevada, particularly the team of Department of Health and Human Services Public Preparedness Program, and the staff at the State Board of Pharmacy, as well as our colleagues at the Southern Nevada Health District. And I'd like to introduce and acknowledge Dr. Michael Johnson, who's Director of Community Health, as well as we also have Jeff Quinn, who's been very instrumental from the Office of Public Health Preparedness. We are all honored today that you joined us for this very, very special multi-agency partnership announcement. Okay? The opening of a temporary monoclonal antibody infusion center for COVID-19 patients here in Las Vegas. Joining me today is also Dr. Stephen Murda, Chief Medical Officer, Sunrise Hospital and Medical Center. And Dr. Murda will be available for specific medical questions, as well as two of our guest speakers, Dr. John Redd, Chief Medical Officer of the United States Department of Health and Human Services, Office of the Assistant Secretary for Preparedness and Response, as well as Lynn Hayes, Commander, the National Disaster Medical Assistance Team of the Office of the Assistant Secretary of Preparedness and Response in the U.S. Department of Health and Human Services. Before we begin today, a couple of housekeeping items for our media visitors. As many of us are in line of sight of our trauma bay, we might have some ambulances coming by, and I ask, just to protect the privacy of any patients, that if ambulances do arrive, that we take a close shot to avoid any pictures of our patients. And following today's news briefing, we'll given the opportunity for one-on-one interviews as well as a tour, interviews with any of our speakers. And we also have some digital assets for event that will be available to you for your stories. Sunrise Hospital has discharged 657 COVID-19 patients to date. We wish we could say that is the end. However, today at Sunrise Hospital, okay, in addition to our 736 patients currently in-house, 207 COVID-positive patients are receiving care at Sunrise Hospital today. A record COVID-19 volume for Sunrise Hospital. And following the holidays, Christmas, New Year's, the COVID surge has continued, resulting in inpatients waiting for beds in our adult emergency department, as well as our ICUs here at the hospital being completely full. And we anticipate that COVID-19 volume coming into Sunrise Hospital, as well as all of our hospitals in our community, will continue to increase for the weeks to come. Now we have a vaccine in place, and we have vaccinated almost 2,500 members of the Sunrise Hospital family, and our vaccines are becoming and continue to become readily available. Okay? But what could we be done today to reduce COVID-19 hospitalizations? And that's where we're very, very excited with the assistance of U.S. Department of Health and Human Services that we will open and begin administering monoclonal antibody therapeutic treatments, okay, at this temporary monoclonal antibody infusion center for COVID-19 patients. This is the third federally supported infusion clinic in the country, selected by the state of Nevada to to be located here at Sunrise Hospital. When physicians refer vulnerable COVID-19 positive patients requiring admission to a hospital, they will receive an aggressive treatment plan of monoclonal antibodies, and we will reduce the overall related hospital admissions in the Las Vegas metropolitan area. This is just one more way that we could end the pandemic together. And now I'd like to turn the podium over to Dr. John Redd, Chief Medical Officer for the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Preparedness and Response. Dr. Redd?
Thank you very much, Mr. Sklamberg. Good morning, everyone. My name is Dr. John Redd. I'm the Chief Medical Officer of the Assistant Secretary for Preparedness and Response, also known as ASPR, at the U.S. Department of Health and Human Services in Washington. I'm a clinical internist, a specialist in adult medicine, and a medical epidemiologist. I want to thank Mr. Sklamberg and all the staff here at Sunrise for their warm reception, for their enthusiasm in bringing these new treatments to bear for patients here in Las Vegas. And I want to thank, over the entire course of the pandemic, the efforts of the state of Nevada to put us all on the same page in what is very clearly a team sport, which is the national response to this pandemic. So throughout the response, the federal government, state government, the HHS regions, we've all remained as one in our efforts to combat COVID-19 in the United States. Today, what we're talking about here in Las Vegas is a very, very positive event. We're talking about provision of care in a phase of illness for which, up till now, for people with COVID-19, we've had very little to offer, and that's monoclonal antibody therapy. What I'd like you to think about is think of the sequence of events that happens when someone gets COVID and then becomes ill. Of course, by far, the best thing to do is to prevent COVID-19 in the first place. For that, we have social distancing, masking, hand washing, and now, thankfully, we have vaccine. I just got mine on Monday, and I would encourage everyone to obtain their vaccine. However, as we can see by the situation here at Sunrise, we still have many, many cases of COVID-19, many hospitalizations, and both here in Southern Nevada and around the country, hospital systems are suffering from an overwhelming number of patients. So what we offer today and here at the Infusion Center is new monoclonal antibody therapy that very specifically targets for treatment people who are early in their COVID-19 disease. These products are intended for people with confirmed COVID-19 who have risk factors. And it's a wonderful event in the history of treatment of COVID-19 because previously we've had so little to offer in this phase of illness. The antibody therapies that will be infused here, and Lynn Hayes, the commander of the team here, will talk about the patient experience in a moment. The antibody therapies that are going to be infused here go in over the course of an hour. The person is observed for an hour afterward, and then they go home. And here are the numbers that are extremely favorable, especially when you look at the heroic efforts of an institution such as Sunrise against COVID-19. These products can reduce the rate of hospitalization in people with risk factors from approximately 15% to 4%. That means we can reduce the rate of hospitalization by approximately 70%. The other way to look at it is that for every 10 people who are treated with these antibody products, you avoid one hospitalization. And that would be wonderful. So just imagine that for every 10 people that go through the doors here, you've avoided a hospitalization. And that's what we all want for the country and for the state of Nevada, and of course for Southern Nevada and Las Vegas. So today I wanted to turn, I'll be happy to take questions later, but the commander of our DMAT here Lynn Hayes is going to speak about the patient experience here at the tent and then be very happy to take questions. Thank you very much.
Thank you, Dr. Ed. It's an honor to be here at Sunrise Hospital. As mentioned, I'm the team commander for the Connecticut 1 Disaster Medical Assistance Team, known as DMAT, through the National Disaster Medical System, ASPR, and HHS. I am the team commander, and DMATs are one of 5 specialty teams within NDMS. With me are 10 of my teammates. We are nurses, paramedics, a safety officer, pharmacists, physician, and EMTs. And we've deployed here to help the staff at Sunrise Hospital to establish the Sunrise Monoclonal Antibody facility here. Behind you, you will see our infusion site. The site is actually a 40 by 40 foot tent. It has both heat, air conditioning, it has electricity, as well as a complete computer setup, so we're able to record all of our patients' records. We have 8 beds. We can treat up to 32 patients per day, and each treatment takes about 2.5 hours. So what the patient experience will be is our patients will enter from over here, and they will come in, they'll be greeted, they'll have a quick assessment, they'll have their vital signs done. They then will be escorted to the infusion area where they will have their IV catheter placed, their infusion started. We will closely monitor them for an hour. When their infusion is done, we will continue to observe and monitor them and make sure they're feeling well for about an hour before they're discharged to home. And our goal is to keep patients who qualify for this treatment out of the hospital. Sunrise, similar to almost every other hospital in the country, has limited bed capacity. The staff here have been working tirelessly around the clock to take care of patients. And the more people we keep out of the hospital, the better it is for everyone. Thank you. Mr. Sanders?
Thank you, Commander Hayes and Dr. Red, for briefing the entire community on the benefits of the infusion clinic, which will open up at 1 p.m. today. We're going to open it up for some questions. However, several of you have advanced a couple of questions that perhaps I'll look to Dr. Red and Commander Hayes to help answer, such as some of the specifics. When is the clinic going to be open up? What are the hours? And how do I know if I qualify for treatment? So maybe Dr. Red, if you could.
So our hours will be starting at 8 o'clock. It will be by appointment only through a patient's physician. They can work with their physician to get the information to make an appointment. It will be from 8 a.m. to 5 p.m., which will include the 2.5 hours for patients to be seen. And Dr. Red, do you want to talk a little bit about the qualifications? Thanks.
Sure, thank you. And I, in particular, would like to direct some of my remarks at referring physicians in the community, because it's extremely important that referring physicians become aware of these products and refer their patients in. So I do want to go over for whom these products are intended and how they work. So first, how do these products work? The way that I view them is that they are giving you a head start when you have COVID. When any of us is infected with the SARS-CoV-2 virus, which causes COVID, we develop antibodies in our own bloodstream, in our own system. That's normal. what these products do is they give you a head start. You've got early COVID-19, and through getting an infusion here, you're getting a tremendous number of antibodies that start fighting the COVID-19 virus right in your bloodstream. So that's the way I look at them. They are intended for people who have confirmed COVID-19, so that's with a test. It can be a rapid test or a PCR test. And then secondly, it's intended for people with risk factors. There are some specific risk factors, but the primary ones are age, so that's greater than or equal to age 65. Anyone hearing this with documented COVID-19 disease who is age 65 or older is eligible. I'll pause for just a second. Secondly, anyone who is 55 years of age or over with a cardiac or pulmonary condition is eligible. Thirdly, anyone with a body mass index, a BMI, which is based upon weight and height, of 35 or older is eligible. And then people of any age with certain chronic conditions are eligible. Your physicians will know what those conditions are. And the thing I do want to emphasize for both physicians and patients is that these products are approved for up to 10 days after onset of symptoms. So the first symptom that you get, cough or headache or fever, whatever it may be, you're eligible for 10 days after that symptom. However, I want to emphasize the earlier the better. So we're really putting a big emphasis on early identification of patients, early testing, and early referral to this center right here. Thank you.
One other question that came forward, in advance, and Dr. Red, we're hearing a lot about some of the challenges from the variant from the UK. Maybe you could comment if this has changed our infusion protocols at all?
Yes, thank you very much. So the question is in reference to the new variant of the SARS-CoV-2 virus that's been reported from the United Kingdom and now has been reported in the United States. That has been a mutation in the RNA of the SARS-CoV-2 virus. Such mutations are actually expected to happen, especially in viruses that are RNA viruses. Happily, the presence of that variant has not changed our protocols for this infusion at all. So although we are continuing to look at that variant extremely closely and follow it in the United States, it has not changed the program for here for the therapeutics, and we would still encourage everyone with confirmed COVID-19 with risk factors to avail themselves of this therapeutic.
We had one other question in advance, and then we'll open it up to the media for any questions. And I think, although Dr. Red referenced it, maybe I could ask Dr. Murda to come up and address specifically the referrals coming into the infusion center and what other physician offices, urgent care centers, emergency rooms need to do in order to refer a patient over to the clinic. Dr. Murda?
Thank you, Todd, and thank you, Dr. Red and the team. This has been an incredible opportunity for us, and we went into motion over a week to stand this up because we knew every day as the COVID vaccine was being rolled out, we knew that we also had to get those people that weren't fortunate to get the vaccine before they became infected. So what we're asking is once a patient is identified by a physician or an urgent care, that we have a number that we will be providing for the individual to, once they've met the screening criteria, to call that number, have the patient call the number, and they will be scheduling an appointment. We're running 4 blocks of timelines at 8 o'clock, 11 o'clock, 2 o'clock, and 5 o'clock, where we'll bring in 8 patients and treat them. So the goal is to call that number. I don't have it in front of me, but we will get it to you. Make that appointment. Arrive 15 minutes before. Stay in your car. And then we don't want our COVID-positive patients out and about, walking around. We want them to stay isolated, come in as we're asked them to, and then treat them. So that's the plan. Thank you.
We will open it up to any questions that the media will have, and then I will help facilitate the answers.
How many times do patients have to come, or like how often do they have to come to get the treatment?
Okay, I'll ask Dr. Mert or Dr. Red to answer the question just about the frequency of the treatment.
I'm sorry, ma'am, if you don't mind, could you repeat the question, please?
How often do patients have to come, or how many times does the treatment take?
Oh.
Yeah.
Yes, so yeah, thank you very much. So these treatments are a single infusion. So it's one time. And that's part of what makes them so convenient and so exciting. So again, I want to emphasize the key features are early reporting to your physician of symptoms, early testing, and then rapid referral right here. We've set up a very convenient system. And it's a one-time deal. Thank you.
So with 1 hour of infusion, we reduce hospitalizations here in Las Vegas by 70% for COVID for those patients who meet criteria. Other questions?
What type of follow-up treatment is involved, and will the patient incur any cost?
Okay. Dr. Murda, maybe you could answer that question as to what other follow-up treatments might be necessary, following the infusion, and then is there any cost?
Well, thank you. Thank you for that question. Any follow-up treatments? The answer is there aren't any. Once you have that infusion, we'll return you to your home where you will continue to monitor your symptoms. If your symptoms, unfortunately, were to progress, then the recommendation would be get a hold of your physician for follow-up for further therapy. So there is no additional. Thank you.
And the cost? Is there any cost involved? Okay.
Yeah, no. The federal government has provided the team and provided the medication. So at this time, there is absolutely no cost to anyone getting this infusion.
Why did you decide to start this here in Las Vegas and not in another city in the U.S.?
Well, let me answer. I'll be happy to answer that question too about the siting here in Las Vegas. But first, in reference to how the products have been made available, is similar to vaccine, which you all have heard about. The program called Operation Warp Speed has developed and then procured vaccine and therapeutics. And in the case of vaccine and the new therapeutics, the cost to the person is zero. These products have been procured by the United States government on behalf of all Americans and in pursuit of treatment of people all across the United States. I want to say this again very clearly. These medications, as well as vaccine, they are meant for everyone across the United States. We're all in this together. This has been a group effort. We did this on behalf of the people of the United States for human beings all around the United States. So I just really want to emphasize that. And then in terms of why this site, well, a lot of it actually has to do with a combination of a very willing partner, and I again want to commend Sunrise for their flexibility, and I want to say something else that you all really should be proud of. I know that Las Vegas has been through difficult times together, including right here at this very hospital, and I really want to commend their spirit. People here have been working on this pandemic for a year, yet despite that, the staff here are flexible, willing to take on a new treatment, and looking forward to try to change the direction of COVID-19 infection in southern Nevada, and I can't say enough about them. I really commend the staff here. So it's a combination of need, a willing site, and availability.
We'll open it up to any other questions before we do a tour, and then we will have members of the team here also available for any individual interviews.